Welcome to the Caregiver Relief Podcast. I'm your host, Diane Carbo, RN. And if you're a caregiver, you already know what it feels like to live under constant pressure, making decisions, managing care, and often putting your own health last. But what if that stress is doing more than just making you tired? What if it's quietly impacting your heart? Today, we're diving into a topic that every caregiver and senior out there needs to hear. I'm joined today by Dr. Melanie Icard, known as Dr. Mel, a naturopathic doctor with over 10 years' experience in integrative cardiovascular health, metabolic optimization, and mind-body medicine. She is the creator of the Biohacked Heart Blueprint, a program designed to help people reverse cardiovascular and metabolic aging naturally. Dr. Mel brings a fresh and powerful perspective on heart health, one that looks beyond cholesterol and focuses on stress, blood sugar, and inflammation and how we live our daily lives. This episode is sponsored by myvitalvault.net, your all-in-one life organizer for aging adults and caregivers. It's designed to help you securely store your essential legal, medical, and emergency information in one easy-to-access place. Because when a crisis hits, being prepared can make all the difference. Join our Caregiver Relief community, a warm, welcoming space where you can connect with other caregivers, ask questions, share stories, and find support from people who truly understand. Visit community.caregiverrelief.com to join now, because caregiving is one of the hardest and most meaningful things you'll ever do, and no one should have to do it alone. And if this episode speaks to you, please take a moment to like, share, or comment. Every click helps us reach more caregivers who need encouragement, resources, and hope. Dr. Mel, welcome to my show.
Thanks for having me.
I'm very excited about this topic because chronic stress, I don't know if you're aware of this or not, but 63% of our family caregivers become seriously ill or die before the person they're caring for. And it's due to the terrible chronic stress. So for those, my listeners out there, what is the biggest misconception about heart disease that you see today?
We'll just start with the obvious one. It's very cholesterol lowering focused. And what I found is that it doesn't lowering the cholesterol doesn't give the desired results, which is less plaque, right? Which is less risk of
Yes.
a major event. And my big problem with it is that it gives us false peace of mind because we think that we're doing something that is going to be protecting our heart or from having a stroke, protecting our brain. Meanwhile, all the damage is still happening. We could have been repairing that. That's the worst part, I think, because you think you're doing the right thing. And then over 50% of fatal heart attacks have normal cholesterol.
Yeah. One of the things that I see as a nurse is the side effects of statins can be horrific. And some of the ones that you develop if you're taking a statin is they don't go away. And that's really hard. So I really look for natural ways or alternative ways to keep the cholesterol and have a healthier heart.
Yes.
Now, you talk about stress as a root cause. How exactly does chronic stress impact the heart and cardiovascular system?
Yeah. So basically, what's become apparent to me is that all of us have been living in survival mode unconsciously for decades.
Yes.
Yeah, like you're saying, like when I bring it up, everyone goes, "Yeah, that hits," right?
Oh, it hits home really. Yeah, absolutely.
And you don't have to be yelling at people or having a life crisis to be in chronic stress. That's the thing that people go, "Oh, I'm not stressed," and it's That's cute. You're so committed to, like, being okay, I love that, but it's still happening. So with the
Yeah.
cardiac people, you have that cartoon cardiac guy with the hot head, and there are
Yes.
really reactive, kind of like the anger's right at the surface kind of they're usually squishy on the inside, but there's also this what I call the Stoics. That everything's fine, I'm fine, but it's
Oh,
still
yeah.
that stress is getting internalized in the on the blood pressure.
That's usually the males.
Yeah, yeah, and I love that you're not yelling at people, but that's not enough.
Yeah.
So it's like a never-ending to-do list. That's
Yeah.
chronic stress. Always being in a rush to hit the next thing. That's chronic stress. Like not liking your work environment. That's chronic stress. Like simple little things when I'm not trying to give you despair. I'm just saying it's not something that we can ignore because it's almost at the top of the flow, right?
Yeah.
Stress and emotions. And there's grief, which is just bigger stress and emotions, right?
Yeah.
So
Yeah.
a lot of times, people's numbers and everything will get worse after a real life crisis, like losing their mother or something like that. And we need to reset. And then, of course, in modern times, there's toxins. And we can't really avoid them. We can do some things. We can stop using the microwave and plastic containers and stuff like that. But in general, you just have to know that you're going to have to be ongoing detoxing. Like detoxing isn't just once every couple years thing anymore. You've got to find an efficient detox and just kind of like you wouldn't clean your house once a year. It would be a mess.
That's right.
Your best house.
You know what? That's a good analogy because we take for granted our good health. We take for granted the abuse that we create in our bodies. And we shouldn't because over time, it dramatically impacts us, as I'm seeing from decades of working with caregivers and seniors. And it's hard. And one of the things I'm seeing in our culture is everybody's stressed to the max all the time. They're so unhappy. Their nurses in particular are getting beaten up by patients, literally, physically sometimes, if not being demanding and overbearing and not being the nurses need kindness too, but the management is always beating up. So everybody's got numbers they have to make in other jobs like marketing and sales. And I was recently sitting outside of a car dealership waiting for some work to be done, and inside was this team of people. They were for cellular phones or something, and the manager was doing a team meeting, and Dr. Mel, I almost died. I thought I wanted to go in there and go, "Young man, behave yourself." This young man is the manager of all these poor salespeople, and he was screaming at them. That was
Yeah.
going to motivate them to do their job. I'm the kind of person I would have said, "Oh, I can't deal with this. I'd have to go." But that's what they do. They put people under a tremendous amount of stress. And so I can see what's happening in our world. That's why I was so excited to talk with you about things because we just discussed many people are told cholesterol is the main issue, but how should we look at that differently?
Yeah. So if you go through the flow after the stress and emotions, your
Mhm.
body's going to pump out cortisol and adrenaline, right?
Yeah.
Which, like, if we go back to say we're prehistoric or whatever, if there is a situation, we need that extra power to get out of there or fight, right? That's where that
Yep.
fight or flight comes in. So your body's sensing this stress and it's trying to give you the fuel you need, but we get stuck there. We don't
Yeah.
shake it off like the gazelle once they get away from the lion. We're still chugging along its stress. And so the adrenaline's going to clamp down the vessels. Adrenaline, maybe that's fun if you're bungee jumping for 30 seconds, right? But like
Yep.
30 years, different story, right?
Yep.
And so that's going to raise your blood pressure, right? Because if these
Yep.
tubes are clamped down, it's going to raise the blood pressure. And then those organs aren't getting that good oxygenated blood that they want. And then they're getting a
Yep.
little sad, right? Meanwhile, the cortisol is telling the body, like, let's pump out some glucose because that's some great fuel for these muscles. So if we got to
Yep.
run or if we got to like book it or fight, let's have some power in these muscles, right? So now our glucose has gone up, but we haven't put any food in our mouth yet. And then I don't know about you, but when I'm stressed, I make the worst food decisions.
I'm guilty of that, always have been. And one of the things I know about caregivers is they're eating on the run all the time. They're putting bad choice foods in their house, high sugary things, eating. They're even taking energy drinks, which I just feel bad because that is not a solution.
And it will raise your cortisol.
Yes, thank you. You know what? I attribute this. Here's something that I experienced as a young woman. I used to love roller coasters. And I loved the feel, the adrenaline rush. And after I had kids, we were at the park and I was like, oh my gosh, I don't enjoy roller coasters anymore because that feeling that I had, that you get with that rush was something I was experiencing every day.
Yes.
And I made that
I
connection.
think I've noticed that, like, anything that's intense, I'm just
Uh-huh.
not into it. I'm like, life's been intense for over 40
Yes.
years. Like, I'm looking for things that make me chillax. Okay. I don't need
Yes.
this ice bath. I can take a cool shower at the end. I don't
Yes.
need, like, I've had enough intensity. Yeah.
Yeah, oh, yeah, and one of the things I noticed personally for me in nursing, as managed care grew and our healthcare system changed, nursing became it was no longer about caring for people and educating them, my patients. I wasn't able to do that. There were everything was given to the aides so that we would do medications and charting and all this unnecessary stuff and it took us away the best part of nursing away from us,
Yeah.
and nursing became so stressful, I would get up in the m I'd be off for a few days, and the day before I'd have to go back to the unit, I'd get physically ill, my stomach, my body was telling me, "Hey, you need to
Yeah.
look at an alternative setting," which I absolutely did, and that was in my late 20s, early 30s, and now
Yeah.
I'm 73. And I did a lot of outside hospital nursing because I wanted to
Relaxed.
be healthier and not live in that chronic sense of stress.
Yeah. You know what I noticed? Because I was a respiratory therapist in the ICU for 11 years. So I worked
God
with a lot
bless
of
you.
nurses.
Yep.
Yeah. And that was intense too, right? But what I noticed is most of the nurses, it was like a 10-year window. And then it was like, they had to
Yeah.
like find some kind of exit strategy. They went to
Yeah.
NP school, they went to family
Yep.
practice, I
Yep.
remember like going to PACU. PACU was like the first step out.
You know what? I have to tell you, nurses are leaving the profession in 2 years.
Oh, now it's 2 years.
It's real, and it is because the 12-hour shifts
Yeah.
and the amount as in
They give
fact,
you
what's
more work to
happening
do.
is that the nurses are being expected to do more with less support,
Right.
and they're getting unsafe, numbers of patients they're providing care for.
Yeah.
And one of the things I'm learning about the younger nurses is they don't want to do that. So they're leaving. You know, we
Yeah.
really don't have a shortage of nurses. We just have a shortage of nurses who will work under those stress,
Neat.
god awful conditions. But it's not just nursing. My family caregivers are being expected to take more and more responsibility on that was once done by healthcare providers.
Okay.
And the amount of stress they are experiencing is off the charts.
You know what, Diane? I just remember. So my ex-boyfriend, he's Israeli. He's been in Israel because his father's dying, and I'm just blown away because it's like they must have a totally different system there. Because I'm like, do they not have a nurse that comes? Do they not have an assistant place? Because it's like he has to give him IVs 4 times a day, and they had to train him how to do this. And it's every other day they're going back to the hospital, and it's I might want to connect him with you too, but it's like they put it all on the family, I guess.
Well,
I'm just like,
welcome to
wow.
reality, Dr. Mel. This is happening in our culture right now.
Is it? I'm just
Our
like,
medical delivery system is now at a point where everything is placed on the uneducated, untrained, and already stressed out family caregiver. I don't know if you know this,
I
but
didn't know that.
they actually there's 63 million family caregivers in the country right now. It's going to double in the next 2 years. And they already provide $1.1 trillion in unpaid care. They are actually the largest pillar of the long term care industry. and they are not represented. They are not provided. They are invisible. They are our biggest home workforce in our country. And the things you're saying that's going on in Israel right now is also here.
Yeah, because he's not sleeping. I don't know how he's gonna, and it's been months.
Yes. In fact, we are moving to hospital in the home.
That's what it sounds like over there.
It's absolutely what he's dealing with. I've done home IV infusions and it's already being done here, but it is going, but you have the company I worked for, we went out, we trained the parent family, we followed up with them, we did that stuff, but there's a piece missing. In fact, here's another thing. Medicare reimbursement has taken away the nursing visits for home care.
Really?
They don't reimburse. So you're not getting, that's such an
That stuff
important
never makes
piece.
sense.
It doesn't make sense. And they'll have OT or PT open the case. Usually it's PT that opens the case now. And the nursing, the education piece or the support for the family and the care recipient is just not there. So that's why I was really excited to talk with you, because there is such stress going it is here, and it's only going to get worse because we have no one to take care of our elderly. Every generation since the boomers has not replaced themselves in numbers. So all the low birth rates we're at dangerous low birth rates for the youngest of our generation. And the youth are our tax base, the youth are our workforce. And we have no one not only to provide care for our elderly, it's going to go on for every single generation. And my concern is not just for the family caregiver, but who's going to take care of the solo ager or the childless couple?
Right.
So this is stress. I'd like to talk because I'm very interested in this. I've read, you mentioned the gut health connection.
Oh, yeah.
How does the gut health influence cardiovascular disease?
Oh, yeah, because it sounds weird, right? The gut and my health. So this is a whole system, right? It's a
Yes.
system of systems. So that's part of the issues that we've tried to do these octopus legs, but everything's influencing everything else. It's like a
Yes.
spider web almost of spirals, right? So all of our guts, more or less, are just inflamed. It's the different chemicals they put in the food. We can go round and round, but there's multiple reasons. Everyone's gut is inflamed and that gets leaky. And so instead of the cells being butted up like a nice,
Yep.
they're fried. And so things are leaking out too into the system, causing systemic inflammation, right? So this can affect your blood pressure, your vessels, in numerous ways this can affect you, right? So everybody that's alive should work on their gut at least once a year, right? And that's gonna heal your everything basically. But I always have people do an herbal detox first. It's amazing. I got this formula where it's all wins, right? So we always start with that because you're like, wow, my energy's better. Wow, my bowel movements are better. Wow, my blood pressure's better, right? Because then I'm going to ask you to do more, right? So I need you to feel good and get the wins, right? So, because then you have to do the nutritional detox. You'd have to get the list of all the things I'm going to need you to take out for at least 2 weeks. And there's at least one you're going to kind of cry about, right? But you're going to be bought in because you're getting these wins. Like you probably lost 5 pounds.
Exactly. We are seeing an over prescribing culture for stomach medications, omeprazole, Nexium. And what we're finding is that there are some severe long-term consequences of being on these medications.
Oh, yeah.
And I can tell you right now that I was on omeprazole, it was Nexium or Prilosec, for 30 years.
Oh, yeah.
And my son worked at Mass General Eye and Ear, and he was a nurse anesthetist there. And he worked with a world-renowned ENT doc who created some products to help with this because he was seeing an increase in esophageal cancers. And I have polyps. Now, you can have 1 million polyps, but you've got to stop taking those medications. The thing is, they have rebound effect. And if you've taken it so long, it's like you're going to have terrible acid. So there are ways, and I'm in this process now of I've done the detox. There is a really strong connection to the gut heart. And I've learned about it just recently. I'm also learning about the role inflammation plays in aging and heart disease. Can you talk about that a little bit?
Yeah, and I just want to say if you're not doing it, the best thing for acid reflux is taking digestive enzymes with your
Yes.
meals.
Yes.
Yeah. And then there's also a product that's like a chewable natural one that kind of helps symptomatically while you're going through that period. So I'll let you know.
Oh, yeah, please. I'd like to learn about that.
Yeah, because those are some simple things. So what was your question again? I'm sorry. I was
No, that's fine. I just want to learn to help explain to my listeners what the role inflammation plays in aging and heart disease and how maybe, and then start talking about your platform that helps you
Yes. So think
approach
about
this.
it, right? Because what do you think about when something's inflamed? Let's talk about like maybe or something we can see like on our skin. It's
Yeah.
red,
Yeah.
it's swollen, it's more puffy, maybe it's a little
Yep.
easy. So that's us on the inside, right? Inflammation, right? So that it can manifest in infinite ways. It could be autoimmune disease, it could be cancer, it could be cardiovascular. You could see how the vessels get swollen. You're going to maybe get more damage, then you get more calcium and plaque,
Yeah.
and it all kind of does compounding interest on itself until you figure out how to stop it, right? Also, we've got a lot more depression and anxiety these days, or at least we acknowledge it more.
Yes.
Both. So, inflammation, because I used to do a lot of work with depression and PTSD, and I would always have them also do the same detox because taking off that layer of inflammation is going to like radically improve the mood and the anxiety and the depression, right? So,
Yes.
basically everything, it's like just clean, everything's flowing, everything's functioning well with less inflammation, right? And that's why when people start the herbal detox, which makes it easy to disinflame, they go, "Oh wow, it has such great energy." And "Oh wow, my blood sugar's better. Oh wow, my blood pressure's better," right? And so if you are interested in this kind of stuff and you reach out to me, I make all my clients check their blood pressure twice a day because it's not uncommon for it to improve quickly in just a couple few weeks and they need to start weaning off their meds, right?
Yes.
The
Yeah,
benefit
and
is
that's a
decreasing
really good
inflammation.
point.
Yeah.
Yeah, you don't want to stop the meds until, but you may have to wean yourself off the meds because I've seen this with clients. They go through the detox and all of a sudden their blood sugars are normalized, their blood pressure is being stabilized, it's improving every day. And then they want to take their meds, take away their meds right away. And or they don't think about them and they're taking meds that they don't need to, and then they're having problems with low blood pressure.
And then that's dangerous and doesn't feel good. So that's why we
Yes.
have to be mindful.
Yeah.
It's really important. And then it's nice to wean off those meds, but you got to know what's going on so you don't over
Yep.
medicate yourself.
Yes.
Right?
Yes. Yes.
Yes, it's just got to be present, and that helps us heal too. Is just being present too.
Can you walk us through what a typical day of heart healthy living might look like using your approach?
Yeah. So I have all my clients when they wake up, it's one of two things. It always starts with a big glass of water.
Oh,
And if they're doing the calcium balancing therapy, because we got to take calcium adhesions out of the arteries, joints, wherever, and put it back into the bones and teeth, then
yeah.
they'll put a scoop of that Merigen in there. Drink the glass of water and wait 30 minutes. I say this is a great time to go outside. Go
Yes.
outside. If you can, go barefoot, get some morning sun on you, and
Yeah.
just think of three things that you're grateful for
Yeah.
and listen to the birds. Notice if there's a butterfly. Just give yourself 10 minutes. Do a little stretch because we forget to stretch, even if it's just 1 minute.
Yeah.
That is the best way to start your morning. Then you can have a cup of coffee or mushroom coffee or whatever. And make it gamify it so that you earn the things, right?
Yes.
Don't jump out of bed and get on your phone and get on the coffee because that's going to pump us more into the stress and adrenaline.
Exactly.
But it's like
Exactly.
if you do it and just notice it and then back the truck up.
My goal every morning is to roll out of bed and get dressed and take a walk. I don't even take a shower. I just
Yeah.
brush my teeth, comb my hair, get dressed, and I get out and I try to get in nature every day. I live near the beach and I like to
Right.
go to the beach a lot. I actually help dog sit so that I'm forced to, on the days when I'm down,
They
forces
love
me to
walking.
get out with the pups.
Yeah.
So I like that. I'm very happy doing that. And it's
Yeah.
interaction because it's also social interaction for me, because when you have dogs, people are always talking to you. And we have a few beaches here where you can take your dogs on the beach without a leash for a few hours every day that
Oh,
it's
they love
open.
that.
Oh, yeah, I love it because the dogs are getting energy, using their energy. They're having interactions with other dogs, and I get to have interactions with humans that love animals. And at least we have that one thing in common when we first meet. So
Yeah.
it's been very important because as seniors, we also are socially isolated.
Yeah.
And I think that getting out and feeling nature, I encourage that every single day to just, I don't care if you're I lived in Minnesota. If you're in a blizzard, put your nose out there in that blizzard for just a minute, even. Feel the snow, feel the cold, take a breath of deep breath of fresh air, that coldness, whatever. It's just important to get out, as I believe, to get
Yes.
out and get grounded with nature.
Nature heals us. Sunshine,
Yes.
air, the ground. You always notice when you go to a beach town that the people are a little bit more friendly and a little bit more happy because they're getting more.
Yes.
That's why. It's just simple physics.
Oh, yes, I agree. I agree. Oh, and it's really important. And you also do practices like gratitude, nature, and the mindset actually creates measurable changes in the heart health. Can we talk about that a little bit?
Yeah. One thing that I tell people to work on is careful what you say.
Yes.
Careful what you say. And I encourage them, obviously, people do whatever they want. I encourage them, don't claim any diagnoses or
Yeah.
problems. And if you have been in a habit of saying that, do this. I make it like a whole movement. I used to, I'm healing from. And that way, because you catch yourself and then you do something to reset it, because it's just like it's like a groove you make.
I'm learning to
Groove.
do that, Dr. Mel, because I did rehab nursing for decades and orthopedics as well. So my lifting and tugging, I'm presently working on healing my broken back.
Yes, yes.
My
Even if you
knees are
feel like you're not
bad.
alone, if you like, "My back is strong."
Yeah,
Even if you feel silly saying it, it's so good.
yeah, but you know what? I want to put the right things out to the universe. But you know what? As a nurse, you're so used to saying, hey, let's talk about your diabetes. Let's talk about your heart health. And hey, your blood pressure's up. What can we do? We look at it from a different perspective. So when I say, oh, I've got chronic pain, I'm healing from chronic pain. I'm learning to readjust my thinking. And that's not it's not that it's not easy, but I have to make a conscious effort to
It takes
change my
practice.
thinking.
It's like going to the gym, like, you just suck at everything at first, right? And then you get better,
Yeah.
and then you get
Yes.
better,
Yeah.
and then you get better. The other thing is a lot of people don't sleep good. I would say at
Yes.
least half the people,
Yeah.
and they don't realize that it's become part of their identity. Oh, I've always been a night owl. So I just say, okay, let's just start by not saying that anymore. And even if you feel like you're full of it, just be like, oh, I just sleep like a champ. Oh, I just love my great sleeps. Because the mind is so funny because it's some kind of survival
Yeah.
thing that just clings to any identity. It's like,
Yeah.
oh, don't, oh, we're a night owl. Oh, yeah, we don't sleep. Oh, yeah, yeah, yeah.
Yeah.
And that's the opposite of what you want because the thing is, we've packaged up sleep and just been okay with poor sleep. Poor sleep causes oxidative damage, causes damage to the blood vessels, causes inflammation. And we haven't evolved past all these layers of sleep. There's a reason we don't even really know all the reasons, right? But we evolved past it. So we want to be getting those. And the other thing is because this happens in modern society, if you're drinking alcohol or taking some kind of marijuana to kind of help you go to bed, you might fall asleep. But it's been proven that you're not getting all the layers.
Yes.
So you're not
Yeah.
getting that whole benefit
Yeah.
of the sleep, right? So just something to kind of lean into because we as humans, we get really attached to our habits.
Yeah.
And that's like a self-talk thing. I have to eat ice cream and have a cocktail before I can go to bed. No, you don't. No, you don't.
Well, I'll have the ice cream. I can skip the cocktail.
Yeah.
But you know what? I had a 95-year-old grandmother that she would hide drinking a bottle of beer at night Or she actually would buy boxed wine, God bless her, Galileo boxed wine, and she would sneak a drink of wine every night, which she only started that in her 80s.
How funny.
And it shocked me because then she would complain about terrible sleep. And, I had to say to her, Graham, I know I'm not supposed to know that you're drinking at night. And it wasn't abuse drinking. It was just overnight. She thought it would help her sleep. I said, that's the worst thing you could do for your sleep. And I had to, explain it to her. We did look at other ways, but it's a lot of people, that's their go-to thing. A drink will relax me and put me to sleep, but it wakes you up. It has this effect on you, and you're not going to have good sleep.
Blood sugar issues. You'll see that when you get on your continuous glucose monitor too. And I just find that's the best thing for patient compliance and getting them on
Yes.
board to make the changes. Like,
Yeah.
so I actually ended up being pre-diabetic. I was so
Okay.
pissed off. And of course I thought I was doing everything right. So because
Yeah.
I was like a naturopath, no junk food, gym, ice bath, and even meditation, right? But I had two things that weren't working for me. And this may resonate with people or may trigger people, but one was I was burning the candle at both ends. I was a single mom with an autistic kid running a medium-sized business.
Yep.
That's a lot of work. And then especially when you're in healthcare, you're like everybody's mom. You got thousands of kids. And then, right? And then I was living a vegetarian lifestyle. And what I found is like with my high stress level, I needed a lower carbohydrate and a higher fat and protein diet so that I could be stable. So when I started, so I had to go a deep dive. Okay, what can I let go of? What can I hand off to someone else? And what do we just throw the baby out with the bathwater?
Yes.
Because like I did this. I wasn't trying to blame anybody. I'm like, this is my fault, like, period. So what am I going to do about this? But then you get empowered, right? If you're looking for someone else to blame, then someone else has to fix you. And it just doesn't work that way.
Exactly.
Get empowered. Don't be afraid of the responsibility. It's power. It's you get in control of your life, right? And it's not that difficult. So then I had to let things go. I had to change. I immediately said, okay, fine. I'm going to put some meat and fat back in here, and then I started monitoring and learning. I did that metabolic deep dive, and girl, there were things that I'd have been going, oh, good job, Mel. Oh, that's such a healthy snack. Oh, you're such a good girl. Blood sugar said a different story.
Yeah.
It said, pow! And I was like, and it's not uncommon, right? Like when everybody starts, they always get surprises. Everyone gets surprises, right? So this is why you have to do it because it lifts the blindfold. Because right now, most of us, we're just flying blind. Ignorance is not bliss.
Absolutely. Yes.
So that was the best thing. And then you find what's giving you that reactive hypoglycemia. You look back and you Nancy Drew you.
Yes. Yes.
And that walk you were talking about, take the walk after you eat. Get that glucose into the muscles where they love glucose and out of the bloodstream. And if you made a bad call on some pasta dinner and you see your glucose, like I always say, keep it to a 30 increase. So if you're going 50, 60, get up and do 30 squats because you'll see it go down in 2 minutes, like 20 points. It's amazing.
Wow. Fascinating.
And for people to say, oh, like I'm a little old, I have a bad hip, a bad knee, I said, just grab the kitchen counter and do an assisted squat because it's just moving those big muscles.
Yes.
And it sucks up that glucose. So that's why I'd say, I love that people go to the gym. You kind of have to, right? You got to do weights. We got to keep that muscle. But the habit you need to get is moving after you eat, right? So if you have a dog, great. They're always up for a walk. So you take them on the walk, you get your glucose into where it's better for you.
Yes.
And that has to be a lifestyle thing, but it's nice. I remember when my son was little, we used to always go on a walk after dinner and take the dog for a walk. And I don't even know why I started doing that. I think maybe he was like hyperactive. I have no idea. But I just thought that's a nice thing to bring back in now in fast forward 20 years and I'm like pre-diabetic, right? And then makes me get outside, right? And it makes me get that nature healing. So it has all these other benefits. The other thing that you can do with your meals is just squish them closer together and have a bigger fasting window because that's where the magic happens. And so we were all told eat 3 meals a day plus snacks. Sad face, that's a setup for insulin resistance. And now we're like 88% insulin resistant. I don't know, the numbers are terrible.
Yes.
So I was a hypoglycemic kid and they always said, feed her, feed her, feed her. Well, that and chronic stress and my vegetarian diet, I ended up pre-diabetic. I could have caught it at the hypoglycemia, but we didn't know. We were
Yeah,
following
we
what
didn't
we were
know.
told, right?
Exactly. Yes.
Just like the low-fat diet. I remember, I don't know about you, I was afraid to eat butter for like most of my life. I was like,
Oh,
sure, okay,
Lord have mercy,
die of a
girl.
heart attack.
My grandfather had a heart attack, and I will tell you how bad the government made the decision that fat was bad for us.
Yeah.
And so what they did was in the 50s and 60s is create the food pyramid where fat was bad for you. So they wanted fat out of everything. My grandmother used to buy what they call ice milk, not ice cream, ice milk. And that was a fad that, and everything had to be fat free. The problem
Oh,
is,
yeah.
yeah, everything had to be low fat. So what happened in the interim is the food industry made the food more palatable by putting sugar in it.
Yeah.
And you'll appreciate this, Dr. Mel. I'm 73. When my mom passed, I was in nursing school. I was 18.
Oh,
And I was trying to go through all her things and see what I wanted to save and what I didn't needed to discard. And one of the things I found was my prescription for formula, baby formula, because
oh, yeah.
they were just starting with the new baby formulas and pushing away from
It was like
breastfeeding.
posh to do baby formula.
Yes, yes. Well, the baby formula was whole milk with 2 tablespoons of Karo syrup, that high fructose corn syrup.
That's
And
what it was.
yes, and it was a dropper of baby vitamins, liquid vitamins. And I'm thinking, it's no wonder we have obesity in our culture because they use sugar instead. The government made a bad choice, as they often do. And now we're paying the consequences by we're addicted to sugar. When, how we use ketchup is a perfect example. Each teaspoon of ketchup has a lot of sugar in it. And I was like shocked. So now it's like we need to change our palates. And
Yeah.
and it's really hard. I too.
Butter's delicious. That's a great that's a
Yeah,
great way
well,
to
you know
start.
what? Yeah. I can remember when, butter was bad and margarine was better. Now it's like, well, margarine's plastic. You need to go back to butter. I'm like, oh my Lord.
Yeah,
And of
there's
course,
so many cases of the opposites. Like,
yeah,
so
yeah,
there was fat fear, and what happened because I remember you want to get low fat,
yep.
dairy, and I was getting my lean cuisines. It was microwaved ravioli. Was that really okay?
I know, really unbelievable.
It's so bad. You're like, oh, and so we all got fat when we were afraid of
Yes,
fat. We
yeah,
all got fat, and
yes,
we all got insulin resistance. Little kids didn't used to get diabetes, like
yes. Now they do. Now it's rampant. It's so sad.
yeah, and it's still happening. I think there's still a lot of like this because it was for decades, so there's still a
Yep.
lot of fat fear out there. There's
Yeah.
still a lot of salt fear.
Yeah.
And also if you really dig into it, the people with less salt, they have more problems because then the body's going to compensate, right? And pump
Yes.
out hormones and raise your blood
Yep.
pressure and stuff like that. But I would say get a mineral salt, get a sea salt that has like sodium and
Yes.
oxalates. But like we
Yeah.
run on that stuff. We run on electrolytes, right? We are like a
Yep.
human electric chemical battery. You need hydration and you need minerals. Sometimes if you just drink water, you're going to pee all the time. Like water wants some friends. It needs some minerals in there so it can
Yes.
stay
Yes.
hanging out.
And if you're peeing all the time and you're not replacing your salt and other electrolytes, you're ruining your body.
Yes. And you're
Yeah.
spending all your time in the bathroom.
Yeah, exactly. Exactly. Now, Dr. Mel, for someone over 50 years of age, is it really possible to reverse or improve cardiovascular aging? And where should they start?
Yeah, you should start with the detox. You can always book a complimentary strategy call with me or my team. We're a very small team, but we will accommodate you. We do live webinars at least once a month so you can learn there. And then we have a Q&A at the end and there's little entry offers that we do, especially on the live webinars. But just 50 you're a baby. Okay. If you're 50, you're still a baby. Okay. You're going to
Yeah.
heal great. Because I have plenty of patients that are over 70 that have
Yeah.
totally healed their heart. I have a guy that went from 70% to 0 plaque and has
Wow.
stayed there for years. He's out golfing every day. He's living his best retirement life.
Yeah.
Why not you? He's not a superhuman, right? I have
Yeah.
another guy, super skeptical. I love this. Flew out from Ohio because they were like, just take meds. And he was like, eh.
Yeah.
And he felt skeptical and overwhelmed by me. And he went home and built a new house. That's how much energy he got. He feels 20. He's like, I would never have done this. He lost 40 pounds, doesn't have a blood pressure problem anymore, everything. And he was so happy to go back to his doctor and be like, look,
Yes.
I'm better. And these guys are 70. And I've had guys that have had major events and then everything's stacking. Diabetic, had a heart attack, on 5 meds. We get them pre-diabetic in a month. We're weaning off of the meds, usually in the first like 1 to 2 months because the baseline improves so much. And even one guy, he just came back to me. He had a heart attack, but you know what? He wouldn't even realize it, right? Then he went in and they're like, "Oh, you had a heart attack." So the heart gets weak when it has a
Yes.
heart attack, right? So they call it the ejection fraction, but guys, it's just how strong the heart can pump, right? Which
Yes.
you want it pumping, right? It's got to be
Yes.
pumping.
Yeah.
So he was down at 20% and on the beta blockers, which slows everything down too. And this was a guy
Yeah.
that was like hunting. He had like a show dog. He had a construction business, even though he was 70 and he was dragging. So he came in and even like just after the first treatment in clinic, he's, wow, Mel, I feel so good. I have so much energy.
Yes.
And the whole protocol only takes about, it depends on you, but maybe 2 months. And
Yeah.
when he went back to Mayo Clinic, his ejection fraction was up at like 50%. And they couldn't believe it, but
Wow.
he could felt it right away, right? Because imagine, like we said, things get swollen and inflamed. That
Yes.
oxygen-rich blood that your cells want isn't getting there. So once we disinflame and vasodilate and put anti-inflammatory things in the system that can heal and repair the vessels, I was surprised, but like people have hope because this thing is like
Yeah.
repeatable. None of these people were like biohackers. These are just
Yes.
fellas and ladies. Just like you, I had one lady that come in and she was cute because she is supernatural. So she
Uh-huh.
wanted any meds. She wanted to do a CT scan to see what her imaging was. And I was like, okay. Her blood pressure was so high. It was like
Oh.
190 over 100. She's like, I
Oh,
don't just
God
like
bless
this
her.
minute. And I'm like, girlfriend, okay, I get you don't want to do meds. So we're going to give you these supplements as a med. Like it's going to be
Yeah.
your band-aid because this is
Yeah.
crazy, lady.
Yeah.
Right? We got to just get that down. But then in a month and a half, she just had normal blood pressure. She didn't need herbs, right? She was like 120 over 80. But one of the
Oh,
things
wow.
we talked about with her, in addition to the protocol, the nice side effect is everyone gets rid of their high blood pressure issues, right? But she is a woman, maybe it's us more. She was noticing that even though she was retired, she was like always on and reacting to stuff, right?
Yes.
She has 8
Yes.
kids and I don't know how many grandkids. And so we just talked about the idea of getting out of survival mode and just, just like not like
Enjoying.
in the nicest way possible. It's not going to sound right, but just not caring as much. Like
Yes.
just things, what can we control? Nothing except our reaction.
Yes. Yes. Exactly.
And I
Yes.
think that was like a little bit of the pixie dust in her radical improvement, was just the idea of getting out of having our
Yes.
foot on the gas and being reactive. So
Well,
that
one
makes
of the
sense. That's a
things
good idea.
about modern medicine is it's reactive and it's not proactive, whereas you're taking a proactive approach to your health or you have a proactive approach that can delay or totally change your body if you follow your plan. And that's what we need to look at. I don't want medicines being shoved down my throat. I don't want to do things I'm trying to do. And this is one thing, baby boomers are demanding this type of products and
Yeah, they want to age
services.
differently. They want to
Yes,
age
they
differently,
do.
and I love
Yes.
that.
Yes, yes. So
And they
that's really
can.
important.
That's the
Yes,
cool
and
thing.
they can. Yes, the science and the information is out there. Dr. Mel, how do my clients and listeners find you?
Okay, so there's a few ways. We have a website. So on the website, there'll be a free masterclass. You can just, if you're like, what is this biohacked heart blueprint? It's just 20 minutes. You can click on that and that'll send you an email so you can watch that video and learn more. And there's a link to book a strategy session on there. And then there's also a link to book to come to our next live webinar, right? So that's fun. So that's Dr. Melanie, Melanie Icard, Icard, drmelanieicard.com. And then you can kind of check it out. It talks about me and we do the retreats and stuff like that. And I'm also on social media. So I'm on most of the social medias at drmel holistic, HOLISTIC. And if you don't have social media, I do have YouTube. So that's easier for some people.
Yes, yes.
And it's ITS DRML. It's Dr. Mel. Yeah. So I try
Oh,
to,
I love that. Yes.
yeah.
I think I have all that information that will be put on a permanent page on my site so that at the end of the podcast we'll have all your links. And if I don't, I'm going to contact you to make sure I have them all because that's really important. I want future visitors to my site be able to find you
Oh, thank you so
as
much. Yeah,
well.
we love it. Because I never thought I was going to be doing this, Diane.
Yeah.
Like, I thought I was going to treat cancer because that's what my mother died of, right?
Yeah.
And then life just has a way, but it's just seeing the people radically improve in such a
Yeah.
short period of time and then
Yeah.
be able to enjoy their retirement. That's
Yeah.
what it's all about because we work hard all of our life and then we don't want to be in an armchair with a bucket of pills and doctor dates. Like,
Exactly.
and even if you're already there, there's a good chance you can unwind that.
Yes. Yes. And that's the important part. Dr. Mel, thank you so much for sharing your information and with us today. I know many of my listeners will benefit from it. To my family caregivers out there, you are the most important part of the caregiving equation. Without you, it all falls apart. So please learn to be gentle with yourself. Practice self-care every day. Check out what Dr. Mel has to offer because you are worth it.